I'm Dr. Kurt Schreiber. I'm the neurologist here at CMH Neurology and Headache Center, also at Missouri Memory Center, which is a project that we've had going now for 8 years, and also with CMH Research Department, which is a pretty new deal, and we're doing new things and new interesting things. And what I wanted to tell you about today was the exciting new things that we've had going on recently, because we've had the great opportunity to be part of some big stuff right here in Bolivar. And I really want to let you know kind of what's old, what's new, and what's next in what we've been doing. Because I think that if you know this, you'll be able to tell other people too. All right, so I'm gonna use my slides, but I'm just gonna keep on track so I don't keep this going too long. But that's my basic introduction, and what I wanted to do was to tell you what's old. So what's old in Alzheimer's disease is Dr. Alzheimer. Did everyone know there was a guy named Dr. Alzheimer? Did you know this? A lot of people don't know it, but that's why it's his disease. It wasn't the patient, it was his disease. And what Dr. Alzheimer did was he made the biggest discovery in 1906. 1906 is when Dr. Alzheimer found out the things that no one had ever seen before when he had his microscope. He looked under his microscope. And what he did is he looked at the brain, well, under the microscope, of a patient who'd passed away doing an autopsy, and he looked underneath there and he saw things that people had never seen before under the microscope. One of those was something called amyloid. Amyloid is a protein that builds up in the brain. And Alzheimer's disease is a memory loss disorder that is caused by changes in the brain. It's not made up, it's not just something that happens with normal aging. It happens due to a buildup of amyloid in the brain. And so he did a great thing. He got famous because he made this great discovery in 1906. And he found, at the end of life, he found out that there was amyloid in the brain. And that's what defined Alzheimer's disease. Now, for many, many years, a lot of doctors wouldn't even think about making that diagnosis until they did like Dr. Alzheimer, which means did an autopsy. And so for many years, this was just passed along until the end. Now, we got better. We got better with this over time because we were able to learn about symptoms that fit with the diagnosis, symptoms that went along with that amyloid buildup in the brain. But what we used to have to do is we used to have to wait and wait and wait until the person was bad enough to be diagnosed with Alzheimer's disease. And so that really, I guess, was accurate, but it didn't help very many people. It didn't help very many people because by the time someone said it's Alzheimer's disease, there wasn't anything to do. And actually, truly, there wasn't much to do anyway until very, very, very recently because there's new things. But here's what's new. What's new is that doctors are now able to find out that it's Alzheimer's disease before the autopsy, right? To find out before people get so bad that anyone could figure it out without having a medical degree, not having to wait, and then say, I guess it is, probably. But what's new, what's really new, is that there are now new ways to find out old stuff. You know, old stuff is what Dr. Alzheimer found under the microscope, but the new ways are new things that we can do with testing to prove that it's Alzheimer's disease. So we've got more ways now to make a definite diagnosis even before the autopsy, long before the autopsy. So it's super interesting because what Dr. Alzheimer found on that day he did the autopsy, it didn't start the day before. Those changes, that amyloid, that buildup of proteins, it didn't start the day before the autopsy. You know, it didn't even start the day that the memory symptoms started. What scientists have been able to find out is that amyloid, that protein in the brain that builds up that is part of Alzheimer's disease, starts building up long before anyone has any symptoms, before any symptoms hit. In fact, it's building up in the brain for 10 to 20 years before a person even has a symptom. And that's what's really kind of new because we have new tests to find that protein, that thing that Dr. Alzheimer waited for the autopsy to do, we can now find building up in the brain when the symptoms are still at their mildest stage because there's new tests to do that. There's a special brain scan called an amyloid PET scan, That's a way to look for amyloid using the PET scanner in the brain. There's a special spinal tap test that can also show amyloid. And what's really the newest of new for all of us is that scientists are really at the point of having a blood test. A blood test that can show that amyloid is starting to build up. The blood test is still close to the finish line, but not there yet. But there are some blood tests that are being used in research to find the amyloid in the brain with a blood test. This is, you would think, why did they think of this years ago? It should be easy, right? It's super hard to do this blood test. It takes really, really big science to be able to find that little bit of amyloid in the bloodstream that goes along with the brain. So what's new now is that we're doing a much better job because we can find the right diagnosis so much earlier than the autopsy, or until having to wait until things were so bad it was obvious, right? So that's kind of what's new, what's happening. But here's what's going on now. What's going on now is so amazing and so interesting because we have been part of this here at CMH. There are drugs that are now currently approved for use to treat Alzheimer's disease that we have never had before. We've had drugs for 20 years that can help some. They can help some of the symptoms, but they don't necessarily change what happens over time. They don't slow the progression. And what's the newest news is that in the last year and 3 months, there have been 2 new drugs that have been approved, fully approved, by the FDA for patients at the early stages of memory loss, at the earliest stages that can slow the progression of Alzheimer's disease by, get this, here's how they work. It's so amazing. They remove amyloid from the brain. They remove the buildup of amyloid from the brain. Now, Alzheimer's disease, what Dr. Alzheimer found in 1906 is still the truth. It's still super important. It's still part of Alzheimer's disease, and amyloid is part of it. It's not the only part. So the drugs that are available for people that have the earliest symptoms of Alzheimer's disease that remove amyloid may slow the progression. They don't stop it, unfortunately. They don't reverse it, but for the first time ever, they can slow the progression. They can slow the progression of Alzheimer's disease, all right? And so that's what's really new. And what we're really proud of is that we here in Bolivar, our patients, Missouri Memory Center, our memory clinic, CMH Research Department, our group of people all through the medical system that help us do this, we're part of that. And we were part of it because we started working on this in 2018. In 2018, in December of 2018, here at CMH, we administered, in a clinical trial, the first time these medications. We had our first experience 6 years ago. Now, there's a drug that we have been working on since 2021 that you might have seen if you read the newspaper, or we've got some news releases out on it that we've got some notoriety for. But there's a big study we've been working on since 2021 for a medicine that removes amyloid from the brain called donanemab. And we'd had 15 patients from CMH that were part of the research trial. We started that. We had our first treatment for a patient in that clinical research study June 3rd of 2021, 3 years and some ago. And this was done at CMH, but around the country and around the world. We were one small part of a big study. And that went finally to approval. That drug that we were working on that research study that was done here was the pivotal piece that led to the approval of a drug that's now called Kisunla, which was just approved on July 2nd for treatment of patients with the early symptoms of Alzheimer's disease. And so we're so happy that we were able to be part of something bigger. And we're really thankful to all of the patients in our practice that volunteered, to be part of a research study that led to a new option, a new treatment. And so when I sit in our clinic, just yesterday morning, I sat with a patient that was referred from a neurologist in Springfield to come find out about this. Because CMH is the first medical center in the state of Missouri to have Kisunla on their formulary, first in the state. In large part, I think, because we've been working on it, but we were proud to be able to do that. Last week, we administered for the very first time as a prescription drug. We'd done it before in research, but we had our very first patients that were treated with this new medicine here at CMH at the infusion center. These drugs are infusion drugs. And we were the first in Southwest Missouri to be able to bring that to our patients here at Missouri Memory Center. And I tell you, when I sit down with patients that are caught at the right moment, that are diagnosed at the right time, that have the right blood test or the right scan or the right findings to show they have amyloid, to offer them an option that no one's ever had before. I mean, honestly and truly, what I tell people is Alzheimer's disease, I'm sorry to tell you that you have it, but I want you to know this isn't your grandfather's Alzheimer's disease. This is yours. And that's different because all the people in the past never had the choices or options or opportunities for treatment. And it's a new opportunity. I tell you, I get a tingle up my spine when I have this conversation because we've been waiting a long time to be able to tell people, and we now have an option. Now, it's not an option for everybody. It's really an option for the right person with the right patient at the right stage, at the earliest stages, and then to find the right treatment for them. So we've got more options than what we've ever had before. But that's really what's been the newest news that we've had since I came to this group 2 years ago. We were just starting those things, we were in the process, but now they have come to fruition. They've come to the clinic and not just the research department. So we're really pleased, and we're really happy to have had the support not only from our own patients, but really from this little medical center, right? This little medical center that was able to pull it off. You might say, how in the world could you do world-class research here at CMH? And let me tell you, it takes a lot of help. It takes a lot of help from a lot of people to pull this off. The kind of research that we've been able to do is most usually done at bigger places, at university-level research centers. So, being able to have CMH become part of this, is really a big accomplishment, not just for me or for our clinic, but for this whole system, to be able to pull together and pull it through and to be part of something bigger. But I wanted to be sure everyone had that news. If you haven't heard it, now you have. But that's not where it stops. You remember I told you what's old? Well, the information about Dr. Alzheimer is old news, right? What's new? What's new really is what I told you about special tests that can prove that a person has Alzheimer's disease before an autopsy is done or before they get so bad it's obvious. That's new tests, new opportunities to diagnose properly, accurately, and earlier, but also for some patients, new treatments. Now, you might say, what's next? So I want to tell you, because we're not stopping. So there's other ideas too. So kind of, what we know, what I just kind of went over, this whole story about what happens in the brain that makes it Alzheimer's disease. One of them is that idea of amyloid. We know at the very end that the brain is full of amyloid. That's what Dr. Alzheimer found. We know that for people with symptoms of Alzheimer's disease, the early symptoms, we can now find that amyloid without an autopsy. But we know that that's been brewing even longer, that it's been brewing for years, a couple decades before they develop symptoms. So there's a question, a scientific question, that doesn't yet have an answer. There's a question, and here's the question. Hold it. If amyloid starts and it builds up over a long time, and if we know removing amyloid when a person has the mildest symptoms, if we know that can slow down the progression of the symptoms, what if a person found out that they did have the amyloid buildup, it was already going, but they still were perfectly normal. They never had a symptom yet. What about those people that might have a family member that had Alzheimer's disease and they're worried about could they have it? Or they were a caregiver for a person with Alzheimer's disease and they have concerns. If those people come to our clinic, we are starting a research study next month in October. It's a new research study. It's going to be a big one, not just here in Bolivar, but around the country, around the world, looking at the next question. If a person is cognitively normal. They don't have any memory loss, but they're already building up amyloid. Would or could a medicine that removes amyloid from the brain, given before symptoms occur, could that delay or prevent going into the memory loss stage of Alzheimer's disease? It seems to make sense, but just like everything in medicine and science, it needs to be tested. And so we are going to be part of a research study for people 55 to 80, okay, sorry, Diamond Club, 55 to 80, that for whatever their reason might be, want to potentially be part of a bigger research study for Alzheimer's disease, who are still good, they're still cognitively normal, they're not in a memory loss stage. They are going to be screened. Screened means, we ask them questions about their health history, et cetera, to be sure they're a good candidate. And those people will receive a blood test that shows amyloid buildup. If their blood test is negative, meaning no amyloid, we can say you can't be in the study. We don't find amyloid. There's no reason to take a drug that would potentially reduce amyloid if you don't have amyloid. That wouldn't make sense. But if they do have amyloid, then they can enroll in the study for finding out if the new drug would or could possibly, the scientific question, right, does it work, delay or prevent the development of Alzheimer's disease? Super interesting question. It's going to take a long time for that study to be completed, but we're hoping, we're ever optimistic, we're hoping that we learn the right answer. If the right answer, it works, we'll be totally happy. But if the right answer is it doesn't work, it was at least thought of and tried and scientifically proven to work or not work. So that's what's coming next. That's what's coming next at Missouri Memory Center, CMH Neurology, and the research department too. So that's going to be our next big project that we're working on. It's going to take a long time and a lot of help. But when people participate in research studies, that's how we get any treatment. Anything that you get or I get when we go to our doctor's office and they can say, I know something that might help, your provider knows what the odds are of it helping. They know how effective it could be. They know what it could do as far as side effects. They balance off the good effects and the side effects. And every treatment that you take or I take or you take has been tested in research, or else we wouldn't be able to use it. So we are always happy when people are willing to be part of the solution, knowing that it's a volunteer job, right, to participate in research. But there's some people that like this idea and say, even if it doesn't help me particularly, it might help other people down the road. And those are the kind of people that would be interested in being a research subject, a participant in a research study. So now you know about that. Maybe Diamond Club, sorry, I guess you're over the age limits, but you may have other people in your lives that would want to know about that. And if you do, we can always have anyone that just wants more information, contact our clinic or CMH research department, I guess I should say. And our research coordinators can talk to them and say, here's what we're doing, do you want to know more? And they may say, thanks for the info, not for me, or they might say, let's get together and work on that. So that's what's next. That's a big project, but that's our next big project that we have lined up. But I really want to make sure that you know that this is the little medical center that can do those kind of projects, because they are big, they take a lot of hands, they take a lot of help, and we've been so pleased that CMH has been supportive of all this extra work that goes on to make something like this happen. And I guess we're proud of it, and we hope you are too. I hope that you feel proud that you can share that exciting news, I suppose, with other people that you might know. There's like a crowd of people that stand behind this, through all the departments at CMH, ranging from lab to radiology to infusion to the administration that lets us do these things or helps us do these things really. So it's a big, big, big team effort.